The government of St. Lucia, over the past 25 years, has partnered with the Cuban government to deliver healthcare services, including eye care services, in the public health sector. The COVID-19 pandemic, however, resulted in significant disruption of the provision of essential health services, including the delivery of the eye care services at the former Victoria Hospital, which was then used as a respiratory hospital during the COVID-19 response period. In 2022, according to the World Health Organization, more than 2 billion people were living with a vision impairment, and of these, at least 1 billion people were needlessly living with poor vision due to lack of access to eye care services globally. In St. Lucia, the ministry has observed the growing need for eye care and other services within the public health sector and continues to build capacity in several areas. Post-COVID-19 pandemic, the former Cuban Eye Clinic, as it was called, was re-established at the Victoria Hospital in December 2022, and surgeries resumed in January 2023. However, due to infrastructural and other challenges, the ministry conducted a thorough assessment of the facility, which resulted in the temporary suspension of surgical procedures in March 2023, while other eye care services continued. The ministry then put together a phased implementation of a comprehensive program to strengthen eye services in keeping with the overall agenda of health reform and strengthening. This is in collaboration with our process to accelerate the achievement of Sustainable Development Goal 3.8, universal health coverage, where essential health services will be made available and are accessible with limited out-of-pocket spending. One notable achievement is the phased implementation of the Dr. Betty Wells Urban Polyclinic, comprising the newly established daily 16-hour urgent care unit, the General Medical Clinic, Diabetic and Hypertensive Clinic, and the new National Eye Clinic. Today, we at the Ministry of Health, Wellness and Elderly Affairs stand proud to testify of the tremendous amount of work put into transforming eye care services in the public sector through this state-of-the-art National Eye Clinic here today.
The National Eye Clinic became operational on December 2nd, 2024, with the merging of the Diabetic Retinopathy Clinic, which was once delivered through the former Castries Wellness Center, and the Cuban Eye Clinic, formerly housed at Victoria Hospital. Infrastructural upgrades include the identification of an alternative space, redesigning and retrofitting of the space, installation of additional lighting, air conditioning units, and upgrading of biomedical equipment. The clinic is now equipped with highly sophisticated, state-of-the-art eye equipment to include ophthalmic surgical system for cataract and retina eye surgery, the phacoemulsifier, anesthesia machine, eye surgical microscope and laser machines, sterilizing equipment, and patient monitors, among others. In addition, new furniture was procured to ensure the comfort of patients and our staff. The new and improved space comprises an operating theater, pre-operative room, recovery room, 3 examination rooms, a small pharmacy, sterilization room, nursing station, large waiting areas, reception, registration and triage areas. In addition, the National Eye Clinic has 2 consultation rooms, 1 laser room to accommodate the Diabetic Retinopathy Clinic. Additionally, our staff underwent training in the use of the newly acquired machines, patient flow and infection prevention and control measures. The qualified team of staff, which comprises the Cuban Brigade and our local officers, comprises of 3 ophthalmologists, 1 optometrist, 1 medical internist, a biomedical engineer, 5 nurses, 1 pharmacist, and the auxiliary staff. The Ministry of Health must thank the Caribbean Public Health Agency for the invaluable support in ensuring the safety of the operating theater through environmental testing, as the ministry conducted quality checks of the facility. Since the commissioning of this clinic on December 2nd, 2024, approximately 60 to 70 persons access various eye care services daily. Also, we are pleased to announce the recommencement of surgeries at the National Eye Clinic as of October 8, 2025. To date, 17 tertium cases have been performed successfully, and cataract surgeries will soon follow.
The National Eye Clinic provides the following eye care services to the public: diabetic retinopathy screening, which includes visual acuity, retinal imaging, and grading; treatment for diabetic retinopathy, which includes laser photocoagulation or focal and panretinal photocoagulation; general eye services, examination of the eyes, refraction of the eyes, ocular pressure of the eyes to test for glaucoma, ultrasound of the eyes, pterygium, and cataract surgeries; internal medicine services, assessment of blood pressure, blood glucose, height, weight, and body mass index; education on diabetes and hypertension control and lifestyle modification and prescription refill; referrals and community outreach screening. Eye care services are available Monday to Friday and are scheduled as follows. Surgeries are conducted Monday to Thursday each week, and outpatient visits Mondays, Wednesdays, and Fridays. The public is informed to kindly call Monday to Friday to make an appointment. Community outreach clinics will continue weekly. Persons are asked to contact the Community Wellness Center to find out when the eye specialist will visit their area. Similarly, all patients who are on the waiting list for surgeries will be contacted as to when to come in for their pre-operative procedures and surgery dates. The Ministry of Health, Wellness, and Elderly Affairs thanks the public for their patience and assures of the delivery of quality service through the National Eye Clinic.